Let's take our next story now. And medical officials at the Bank Hospital here in Accra have revealed the worrying phenomenon of kidney disease among young people in the country. According to them, the number of young people contracting the disease is on the rise. Speaking at the launch of an ultra-modern renal center at the facility, senior staffer there, Dr. Charlotte Osafo, cautioned the public to take preventative steps. JoyNews' Mausi Numon has more in this report.
In Ghana, the prevalence of chronic kidney disease is estimated at 13.3%, of which herbal medication, among other factors, is a significant contributor. Dr. Charlotte Osafo is a medical doctor at the Bank Hospital, and she takes us through some of the causes of kidney disease as well as its preventive measures.
The main things that make people get kidney diseases in Ghana, the first thing is hypertension. A lot of people have hypertension, but they don't control their hypertension. So it is important that if you are diagnosed with hypertension, it is very important that you control the hypertension. And how do you control it? There are so many ways. Your doctor will prescribe some drugs for you. You have to take the drugs. You also have to do certain things like reducing your salt intake, reducing your weight, regular exercise, eating healthy. All those are important, not only for hypertensive patients, but also for diabetics, because diabetes is also one of the causes of kidney failure. Infections are also one of the causes. So if you go to the hospital and they said you've got an infection of the kidney and they give you medications, you have to take it.
CEO of the Bank Hospital, Idren Puvan, also noted that the facility is open to the general public for the treatment of kidney diseases.
In Ghana at the moment, there's a huge shortage of dialysis stations. So we felt in order to serve the country, let's open up a renal center. And then also we're trying to make it an all-inclusive package so that it can be affordable for the average person to come in and get renal dialysis. So we offer the services currently to the Bank of Ghana staff, but it's also open to the public, to the private, and we're negotiating with insurance companies to bring those patients to us as well.
Meanwhile, Presidential Advisor on Health, Dr. Anthony Nsiasari, who spoke at the launch, disclosed government plans to institute an insurance system to cater for patients undergoing dialysis.
The cost of treating one patient on renal dialysis for a year is about 50,700. And I'm sure most families cannot afford that 50,700 for one patient alone. That's 3 times dialysis a week for 1 year. It's huge. It's very out of the reach of people. So we also want to also set up maybe a renal fund or get an insurance system which will take care of the renal cases.
Dr. Anthony Nsiasari also indicated government's intention to constitute a law to regulate the donation of kidneys to patients who may have to undergo kidney transplants.
But when a patient is on renal dialysis, the ultimate would have been to have a transplant. As we speak now, I think apart from Kolebu, who has done some few renal transplant cases with assistance from people from the diaspora, we don't have any standalone renal transplant unit. But before we can do that, we have to put the legislature in place. I know that when I was in Ghana, we started something like that. We want to finish it as quickly as possible so that we can have the law out of parliament, which will be backing it so that nobody will go and catch somebody on the street and go and remove the kidney to sell.
Officials of the facility, which currently has a 24-unit renal center, say they hope to expand it in the coming years. Mausi Numon's report for JoyNews.
We take a breather now. We'll be right back on JoyNews Desk. Do stay.